Today we will talk about errors in laboratory diagnostics of cancer. Patients often ask the question, but is it possible to diagnose cancer based on a general blood test, or a blood test in general? It should be said that such work was conducted earlier, in the 70s. The works of Professor Gavel were known, who tried to diagnose malignant neoplasms based on the size of lymphocytes. The studies showed that, unfortunately, this method does not allow diagnosing cancer based on blood tests. Nevertheless, we have improved this method and use this technique to assess the protective capabilities of the human body. This is very important in cancer patients and in patients with precancerous diseases, since it allows for timely correction of its protective resources. The works are published in specialized literature. Those who are interested can read them. I talk about this technique in more detail in my lecture on the diagnosis of malignant neoplasms. It is posted on Patreon. Those who wish can subscribe and listen to this lecture. Nevertheless, a general blood test allows us in many cases to characterize the general condition of the patient. Unfortunately, patients often ask the question, but the erythrocyte sedimentation rate, how accurate and specific is this test? This test is important. It shows the presence of an inflammatory reaction in the human body. But to say that a person has a malignant tumor based on the acceleration of the ESR is wrong. This is a fairly common mistake, although doctors who observe such patients with accelerated ZOE should certainly respond to possible qualitative changes in the human body. There is a special screening program for this purpose about bearings in screening of malignant neoplasms. We will talk about it in my next broadcast. Therefore, a general blood test is a pretty good test reflecting the general condition of the patient. Nevertheless, we can use a general blood test to assess the patient's response to the treatment methods. This is primarily an assessment of leukocytes, lymphocytes. Of great importance is the assessment of the level of hemoglobin in the blood, as well as erythrocytes, since cancer mutations are largely associated with hypoxia. There is a whole group of works devoted to hypoxia, the problem of prognosis in patients, the development of a metastatic process in them after radical treatment based on an assessment of hemoglobin, erythrocytes in the blood. I will prepare a lecture on this problem for you. For those who are interested, you can listen to it on Patreon. And the summary, as usual, I will provide. For open viewing on YouTube, especially often patients ask the question, especially those who undergo chemotherapy, radiation therapy, how often to evaluate the state of the blood. Here I want to draw your attention to the fact that there is a misconception of doctors who prescribe a general blood test for all patients with a certain frequency. Each person's body is unique. There is no second person who has exactly the same copy of the protective reactions in the human body. Therefore, it is necessary an individual approach to the appointment of a general blood test, taking into account the protective resources of the body, taking into account the dynamics of blood changes for chemotherapy, for live therapy. and sometimes use other laboratories, because, especially during chemotherapy, a slight deviation of leukocytes on during recovery of the body in the next cycle of chemotherapy is an indication for the appointment of colony-stimulating factors and dexamethasone. Unfortunately, these drugs have a number of undesirable aspects which we will talk about when I mistakes. The main mistakes in the treatment of patients with malignant neoplasms. Therefore, here a general blood test in order to assess the body's response to chemotherapy, therapeutic therapy, must be carried out taking into account dynamic changes in blood counts for chemotherapy, radiation therapy. In the late 90s, the so-called enzyme immunoassay was developed, which made it possible to evaluate tumor markers or tumor antigens in the blood. One of the main modern errors in the use of these markers for the purpose of screening for malignant neoplasms. The fact is that the use of OVI markers for screening is important. In diagnosing prostate cancer, this is a fairly good diagnostic test for diagnosing. For diagnosing ovarian cancer, I cover these issues in more detail in the lecture material, which I would like to draw the attention of a wide range of patients using the marker for screening. Breast cancer, colorectal carcinomas, pancreatic cancer, is not correct, because these markers are not specific and can react to inflammatory reactions, allergic reactions. In addition, there is a misconception. For example, the marker CUF15-3 is specific for breast cancer. It may react, I repeat, these are not specific factors, and it may react in patients with other ones with carcinomas of other localizations And therefore, unfortunately, the specificity of markers, even the same SSIA, which is used for ovarian cancer screening, are all nonspecific. Markers that allow indirectly indicating the development of a malignant tumor in the human body. In addition, an increase in the Barker level correlates with the size of the tumor mass. The larger the tumor mass, the more pronounced the changes in the blood. There are certain errors in conducting screening programs. But since screening programs currently occupy a colossal place in the diagnosis of malignant neoplasms, I will touch on this problem in a separate broadcast. In the next broadcast, we will talk about screening errors. Among laboratory diagnostic methods, the assessment of the hormonal process is important. But there is an error here too. It is connected with doctors' misunderstanding of the fact that the endocrine system, it is lobbying and has its reaction to environmental changes, to nervous disturbance, to stress reactions. Usually, it has a certain value and thus the assessment of the hormonal profile. This is a rather complex method that indirectly allows us to judge the function of the endocrine system. Nevertheless, when diagnosing thyroid cancer, thyroid gland glucose assessment is important. I also talk about this in my lecture on thyroid cancer. Patients often ask about the advisability of assessing the cautogram and liver function tests of patients with malignant tumors. In the era of coronavirus, unfortunately, the coagulation and anticoagulation systems have suffered the most. And therefore, the assessment of this system using a hologram is an important factor in diagnosing the prognosis of the course of malignant tumors, and should also be used in dynamic monitoring to correct the coagulation system to prevent metastasis, because there is a certain relationship between the coagulation with the effectiveness of the coagulation and anticoagulation systems. As for liver tests, this is an important factor, especially when we plan surgical treatment, when we plan chemotherapy. Of course, assessing the functional state of the liver is a very important factor in diagnosing malignant neoplasms, diagnosing the effectiveness of chemotherapy, the effect of chemotherapy on the human body. In addition, liver tests are important in diagnosing liver cancer and subpancreatic cancer. A separate issue is the errors in the diagnosis of lactate hydrogenase. This enzyme. Evaluation of this enzyme is important in assessing the spread of the tumor process in patients with melanoma. Its appointment in this contingent of patients is mandatory. Doctors often ignore this method of research. In recent years, a new direction has appeared, the so-called liquid biopsy. I will not dwell on this technique. I would like to draw your attention to the fact that currently the assessment of a complex of genetic changes is widely used as factors in the development of malignant neoplasm. It is not that simple. For those interested, my page features a series of lectures on liquid biopsy. Thus, laboratory diagnostics are important in diagnosing malignant tumors, but its role is to monitor the functional state of organs and the effectiveness of drug treatment. Thank you for your attention. You can ask questions in the comments. I usually include answers to questions in the following lectures. He is interested. You can distribute my lecture because patients often ask questions, and doctors do not always answer them correctly. By liking and distributing my video, you help other patients in the treatment of such a difficult disease. Goodbye.